What do you enjoy most about working in primary and children's?
The kids.
Yeah.
No, I don't know. I just love hanging out with the kids.
The relationships that we get to build, especially in the ICU with our patients and our patients' families.
I know it's not easy and it's so heartbreaking seeing their parents be so sad, but it's honestly been so awesome just to be able to talk to them and kind of hear their story.
New population that we were able to deliver, that pediatric experience that this place has been needing for quite some time.
People don't have to drive all the way to Salt Lake every time they need testing done.
I thought it was really cool to go to a new hospital that didn't have any germs yet.
A space that's welcoming and inviting.
It's a beautiful new hospital.
Oh, I definitely say the team.
I love our team.
The teamwork.
Teamwork is really important.
My coworkers.
I was gonna say my coworkers too.
I feel like I've never had such collaborative care before with the nursing staff.
Have an opportunity to talk to all of the different subspecialties here.
There's a strong sense of community within the hospital between the departments.
And everyone just wants to see everyone else succeed.
Our manager, she's just amazing.
I just love our motto of the child first and always. It's anything for the kids, so we love being able to help them out, to help them feel better.
I like seeing them get better and go home.
Our favorite thing about working at Lehi has been
the parking!
Ready, set, go! Go find your parking, guys!
Have you looked over in Lot E? I hear there's a lot of parking over there, and then you get a nice walk into work.
You're right, and I can get in my steps for Live Well.
When have you felt the proudest and why?
Seeing the patients smile when they come down to the cafe to get out of their rooms.
Getting through all of the tours with no incidents.
Grand opening, Kip was out in the parking lot and he was just dancing up a storm like all day. And it was just as we were directing traffic, all the people coming in on site where they just had smiles on their faces.
When my team pulled off the unthinkable of getting this place set up and ready to go to see patients on February 12th.
I was very proud the day we opened. We got to see all of our hard work culminate in patients walking through the front door.
And we worked here before it opened, and then to watch it open, and the little things we had to tweak here and there to make it work. And we've made so much progress, I think, in 100 days.
And we had a team that we prepared and came and split. So half of our team went to MedSurg and half came to PICU. I think I'm most proud now when I see the collaboration. They come down here to bring a patient and everyone's excited to see each other. We take a patient upstairs and there's friends everywhere.
I'd say for me, getting up all the security systems, the cameras and the badge access and everything like that has just been a blast.
I have been able to start up a child life program alongside my coworkers.
Or suggestions that you have that help that baby reach a certain big milestone in their stay here.
Anytime that we can make a difference in a child's life.
Where they've gone the extra mile just to help these kids, take their time with these kids. And
we're able to make a large impact through a quick turnaround time.
Serving the gelato, the smiles on people's faces.
On a daily basis, and it's because of this team right here. The amount of work that these guys put in every day, taking care of the requests of the caregivers out on.
You better lose yourself in the music the moment you own it. You never let it go. You only get one shot. Do not miss your chance to blow. This opportunity comes within a lifetime. You better lose yourself. Music the moment you own it. You better never let it go.
Describe an experience that had a lasting impact on you.
When they were training me to work in the floor care and try to learn as much as I can, I saw the doctors that were working so hard to save this kid's life.
I had the opportunity to be a supervisor and a coordinator, and that has helped me not only increase my knowledge, but share that with others that are just starting in their career.
Being surrounded by such amazing coworkers and a fun environment that just really made me fall in love with healthcare, and so now I decided to completely change my route and go like a whole different direction that I never thought I would, all because of this one job.
And I've had multiple family experiences growing close with them and building a really good relationship.
Probably a few weeks into opening where we're starting to see some of the chronic families that have these sick kiddos come in, and them just being so thankful that we have a location that is easier access for them.
There was one mother who couldn't pay for her meal, and so we ended up comping it, and she ended up crying and thanking us.
One of the parents of the littlest girls that had a great moment with these dance members came up to me and said their daughter was at the point where she dreaded going into the hospital. That the daughter had just told her that that day was her best day ever.
I happened to be walking by a patient, and probably a little 4 or 5 year old guy, little boy, and he walked around with this big smile on his face, looking around just going, I love this place, it's better than Disneyland.
I looked around and saw all of us in our different areas working together to save this boy's life, and it just brought me a lot of gratitude that I could be there and I could be a part of this.
You better lose yourself in the music the moment.
How did they get you to do this?
He loves
It's
his
something
job.
that's called, you give an inch, they take a mile.